Hello guys, welcome to the Delivery Room podcast. The mic is on.
The room is sacred.
Let's talk. So today we're here to speak to you about what to expect after birth. Obviously we know that a lot goes into, I think postpartum is a huge part of this whole journey. So we're going to touch on a few of the highlights of the things to know as a first-time mother, as a mother in general, things you probably didn't know, and a little bit from our perspective as midwives as well. So you guys can have a bit of mercy on us sometimes. Because
So I feel like postpartum looks different for everyone. Again, just like pregnancy, birth, it looks different for everyone. I feel like depending on how you delivered as well, also impacts your postnatal period, depending on things that happen during your labor as well, can also impact how your delivery went. Obviously, if we start off with like a straightforward delivery, spontaneous vaginal delivery, tears, no tears, sutured, postnatal ward, usually 6 hours.
quite straightforward,
Usually 6 hours for you to stay, and then home if everything's well with you and baby. Obviously baby would need an IP check, and an IP check can only be done after 6 hours after birth, which is why we say to stay for at least 6 hours. Obviously, again, it depends what time you deliver, because if you deliver at 1 a.m, you got to wait till the NIP midwife comes in. So I don't know how it works in other hospitals, but in the one we work in, we have an allocated NIP midwife that works in the day. So either from 7:45 a.m. to 7:45 in the evening, or 9 to 5. Sometimes it just depends. So essentially, if you give birth at like 1 a.m. at night, you have to wait until the NIP midwife essentially comes in the morning. And obviously, your baby won't be the only baby that needs an IP. They would go around the ward and do every baby that essentially needs an IP. So sometimes that 6 hours can drag. But if you're very lucky, a lot of the time birth center, because birth center, most midwives can do an IP. True. So as soon as you're delivered, 6 hours later, they do an IP, and then
boom, bam, bash,
off you go to your lovely home.
So
that would be like straightforward, which is essentially what we'd love for everyone.
And then I guess in other ways you might stay a little bit longer if you had a temperature, an infection, if you're on some IV medications for whatever reason, if you had a cesarean.
It's at least 24 hours. Some people do go home after 24 hours.
Yeah, that's what I'm thinking.
Some people do,
because most
wait
people
a little bit longer.
Overnight.
It's at least 24 hours. You can't.
Also depending on what type of, if it was an emergency or an elective.
Or an elective, because it depends what time your catheter comes
that's
out.
What I was thinking of when I was saying it before.
Obviously when you have a cesarean, you have something called a spinal block. For most, we do use general anesthetic, but that's like a last resort. Like we would never offer
as the first
anesthetic first. Obviously, if you had medical reasons as well as to why you couldn't have a spinal, of course, then they would use GA is what is used for short. So depending on if you had a spinal, so spinal wears off differently for everyone. Like some people's spinals actually, like spinal block, work a little too well. And they can be immobile for quite a while. But then you have others who actually wears off pretty much after six hours, and they're able to mobilize, have their catheter out and walk. So again, everyone's situation is different. You will stay in hospital for a different amount of times. Sometimes you won't even be in hospital for yourself, you'll be in hospital for baby. If your baby's admitted to the neonatal unit, or if your baby's on IV antibiotics, or if your baby had a risk factor such as done a poo. Waters were gone for more than 24 hours. 18 hours. Want to mention any more?
Just unwell, grunting. There's just loads of various things.
If you had gestational diabetes, if baby was small,
preterm,
so
there's loads of different.
There's loads of different reasons. But in most cases, we call it an orange hat pathway, which is basically when we give your baby this this woolly orange hat, and your baby has to stay in hospital for at least 12 hours of observation, just to make sure they're nice and clear after their risk factor, whatever the case is, and then hopefully home time.
So I feel like I'm trying to think where you start to like pick it up postnatally. I think we've just spoken about kind of immediate factors that you could potentially stay in hospital for.
Yeah.
But like to get into it, like where do we start?
It's like the hospital. Okay,
trying to
let's start with the hospital.
Bite-size it up.
I feel like a lot of y'all got a bone to pick with us midwives on the wards, the postnatal wards.
Everyone seems to dislike the postnatal. We don't like it that much either.
We don't.
But yeah, carry on.
I think, obviously, most common issues that we hear is like things like I was ringing the bell for ages and no one came, or I was struggling to feed and no one helped me, and things like that. I feel like, guys, obviously, I know, like for the women that have given birth, it's definitely overwhelming. Yeah. You're not in your own bed. You're in the hospital already. White coat syndrome, like we spoke of before. You're just not comfortable. You don't have that much space. There's other babies crying, other women screaming in pain. You might have your spinal block. You can't move. You have to rely on sort of someone else for everything. It's really difficult. But guys, imagine us. One person looking after up to 9 people at a time. Sometimes you could be looking after 9 people that have had a cesarean.
By the way, guys, that's 9 women.
Yeah,
and
9 babies. Yeah, just that's to make that clear. So that's 18 humans altogether.
Versus my one small self.
One.
Right.
Sometimes you do get women that have all had cesareans. You've got about 5 people that are immobile, 5 people that basically need you on go. And then you have that. And then you have to consider medications to give.
Yes.
Sometimes you have baby observations that we spoke about Orange Hat Path, where your baby needs to be observed every 2 hours.
And that 2 hours comes by so quick. You do it, you do this, that, and then you need
blink
to do it again.
And you need to do it again.
And I've had times where I've got like 4 babies on OBS.
And due at the same time. So sometimes you have to stagger it and start like 10 minutes before.
Yeah.
So you can get like everything done on time, and then you have to give pain relief, you have to give medication, you just have to give feeding support.
Oh,
guys, like we're humans.
On top of that, we need to document
for every mom and every baby.
A note for 18 women. The time you need for that, you don't have, and you can't just write whatever. You need to make sure you're writing properly, you're writing detailed, you're signing off your medications and stuff. It's tough out here, guys.
It is actually tough out here, and that obviously doesn't take away how tough it is for the ladies. But let's come to a mutual agreement that it's tough.
Let's give each other grace.
Let's give each other some grace. Work with me. I always try and apologize where I can, because sometimes I am late with medication because I can't control it. There's too much going on. Sometimes, a lady will ask me, like, for example, like someone rings the bell, you go and they're like, can I get, I don't know, feeding support. Okay, fine. Just give me 10 minutes. Someone else asked me for pain relief. You go and ask you're on your way to give someone else pain relief. On your way to giving someone pain relief, someone else is coming and saying, can I please have this? And then you forget that you're meant to give feeding support to the first person because 2 people
have come in.
And I'm human. I'm sorry. Sometimes my memory do be failing me. Like, I am human. Like, I can't lie. What is the ghetto? It is actually the ghetto. It is the ghetto. Like, I always say, like, I always make it clear to my woman, please, like, if I forget, just remind me, like, call the bell again for me, call for me again. Like, do you know what I mean? Like, sometimes I will say, give me 5 minutes, and I'm taking longer than 5 minutes.
I think I always take longer.
Yeah. But just remind me, like, if I forget, please remind me.
Yeah. And like, I try to make it a point to, like, if especially a day where you've come on and it's full, I'm like, it's really busy today, so just bear with me. Like, I always try to say that so they know, and like,
understand a little bit.
I am coming, just give me some time. Because sometimes giving someone their antibiotic takes importance over quickly doing draining a catheter or something. Do you know what I mean? Like, if your catheter
things
is
that
full,
take priorities over others sometimes,
and you're asking me to drain it, but I'm like, I'm coming, I need to go and give this person the antibiotics. So sometimes, as cruel as it may sound, we have to see what can be prioritized, and we have to kind of work our way down from there. It doesn't necessarily mean that
you're not important, or you're not, or what you requested.
You come across some people who are so lovely, who will understand and they are patient with you, and then you come across people that you tell them 2 minutes and quite literally at 2 minutes, they're screaming at
Where's
you.
my pain
I
meds?
asked you for this.
I asked you for this.
Please bear with, and try. I feel like whenever I work on the postnatal walk, I am at 120 miles per hour.
All the time.
All day.
Unless you have an empty bay, which is hardly
ever. Maybe I've had that twice in 2 years.
Yeah. Like, it's hardly ever that you have an empty bay. And then you have everyone wanting a side room and guys, the side room. There's
I think there's a stigma of like paying for rooms, which I think
it's coming back. It's coming back. A midwife told me. A senior midwife told me they need some money. A midwife told me recently that the paying thing is coming back. So that you were able to do that, and then it was scrapped. It was scrapped during COVID because in COVID they were using all the side rooms for those who had COVID and any other infectious diseases. So that kind of continued after COVID. So now we give side rooms to those who have infections, who have anything contagious,
prolonged
basically.
Stay. Like sometimes when your baby has jaundice,
that
and you're
I
here for
understand.
ages.
Like I always try and prioritize those that have been here for ages, because being in a bay for more than 2 days, I'd say, is very much no. Like no one should be having to do that. So I always do try to say, okay, prolonged stay should actually go in a side room.
But that's interesting if they're bringing that back.
Yeah, they are. That is going to be a battlefield. I'm not ready. Everyone, can I pay? Everyone, can I pay, please?
Give me £10. Give me £10.
Oh, even pay. The people then be bribing as well, you know.
Yeah.
Oh no.
You can't buy me.
I've had someone bribe me to go over for ARM.
Hey!
Yeah, and I was like, we don't do that here.
You
and
can't
even
bribe
if I could, I can't physically move you over to Labour Ward if there's no space. So thanks for the bribe, thanks for the money, but I can't take it, 1, and 2, even if I wanted to, I can't get you over there because there's no staff to look after you. But I've received bribes before in this job.
That's so funny. You're 20 if you break my waters. No, that is insane.
And sometimes they'd be like, do you want anything from the shop if that helps? And I'm like,
no. I got my water.
No. Do you know what I mean? You. But the side room thing, I feel like it's going to be a battle.
That is going to be a battle. But also I feel there needs to be a system, because
there is.
It can't just
it needs to be
that.
Maybe a pre-book thing.
But then as well as that, they need to reserve some for the people that actually do.
It's probably going to be like a limited amount.
Interesting.
I think it's going to be a
highest
limited
bidder
amount.
wins.
But like we were saying before, you were able to pay for these rooms, but you can't. So now we have a system in place that only allows specific people to be moved into those side rooms, because sometimes we get those fresh from a section. Can I have a side room? No. Can I just say that we will never put fresh cesarean if it's the same day that you've had your cesarean and given birth, we would never put you in a side room. We would never do that, because you are at risk after your cesarean of a lot of things still, potentially bleeding afterwards, infection, so many things that we might need you to transfer you maybe back to theatre potentially, or over back onto Labour, where you get one-on-one care immediately and quickly. If you're in a side room, the way we're going to be struggling, busha, the way we're going to be bashing because the room is tight.
And not just...
So in a bay, all we have to do is whip open the curtain, doors open, boom, and you're out. In a side room, we're going to be bashing those doors to get you out. True. And there's a delay in care, and delay in care means more risk, more problems, delay in treatment.
But also as well, can I just say, like, if your birthing partners go home and you're on your own, you can't help yourself, and something happens to you and you're in the side room, how will I know? Yeah. Because I can't tell you how many times someone has called me for someone else. Yeah. Because, like, for example, I once had a case where the lady fell asleep and her baby
the baby fell.
And the baby rolled. And it was another patient next door that heard the baby drop, that called the buzzer. And then when I went, she said, I think you need to go into the lady next door. And it was needed.
Yeah, it's true, because if you're in a side room,
no one would know. And God forbid your baby is, and you're fast asleep. Like, it's, like,
good on those women. I love the women that be calling you because they're concerned about
other people, because it is.
The person next to them.
I always say to my ladies that had C-section, you will not be going into a side room for at least a day. If you're here after that, most people will go home after a day. Yeah. But if you're here after that, then you can reconsider it, but you have to speak to the people on that side and people in charge.
And there's not that many rooms, guys, man. There's not that many. I feel like when I say there's no side room, they think I'm lying. And sometimes we do have like those are empty, but it's like someone from Labour Ward is coming in there, like it's been reserved for someone. So sometimes you walk past here and they see an empty room. Okay, what's that then? I'm just like, it's been
and
reserved.
Sometimes the room even needs to be clean. There was an infectious lady in there.
It needs to be fogged.
And you're there, you're coming at me. Walk in there.
You want to get what the last person had? Do you know what I mean? I feel like sometimes they think we're lying. I'm like, I'm not lying. Like, there's no, like, don't you think if I could give everyone what they wanted here, I would give you what you want?
Because it would even make my life easier.
So harsh. And like, sometimes when I'm already like having a bad day and then someone's shouting at me or saying I'm lying, I'm just like, I just want to go home. Do you know what I mean?
Yeah,
like,
it's just
I feel like let's both be graceful to each other.
Yeah.
Like, I'm here to help you and I can only help you if you try and help me too. Like, I know sometimes my 5 minutes might not be 5 minutes, but I've got you in my head. Sometimes, again, I might forget, but like I said, just remind me.
The amount of times that sometimes I've, like you said, you've gone to do one thing and then done 3 other things in that time, and I've come down and I'm typing, I'm like, this woman, and I literally run and I'm like, I'm so sorry. And
do you know how many times like someone's asked me for something, like, I don't know, like a tea for the baby bottle, and then my shift's finished and then I'm in the car driving and I'm like, I forgot to give that lady her tea. And I'm just like, oh my God. And I feel so bad. I'm just like, oh my gosh, how the hell did I forget?
No.
Like, sometimes you're driving home, you just remember, my God, I literally forgot to give this lady something. And I'm like, oh my God.
It's a lot. And I think your plan that you set out during the day it's not the plan because things are constantly changing.
You get new patients, people going home, and then you have the discharges on top of everything.
And I know you guys want to go home, but bear with, because we have to do paperwork before we can send you home. There's a lot of paperwork.
Wait for your medication.
Get your meds.
And sometimes the doctors not be prescribing the TTAs. Sometimes they be doing it wrong and you have to go to them and get them to do it again. And sometimes even getting hold of them is wrong.
It's not as straightforward as, the doctor said I can go, so let me go. It's not as straightforward as that. Like, there's things that need to be done in place properly. We need to now come and have a talk with you as well. But I feel like a lot of the times, it's like on ward round, when doctors are like, you can go home today. 5 minutes after, the doctor said I can go home. When can I leave?
And it's also the doctors as well. Yeah, doctors. Any doctors watching this, please, when you're discharging the patients, please tell them you gotta wait for the midwife, because sometimes just be like, I'm happy for you to go home, and then the patient's like, all right, I can go home, and it's like, hey, we're there.
You need to definitely tell them that it's midwife-led discharge now. Yes. So you are discharged from my care as a doctor,
but now the midwife also needs to discharge you from her care.
So you need to bear in mind, because the pressure is much. It
really is. Oh God, postnatal ward is the gets.
Yeah, I think we've touched on it.
I love it though, not gonna lie.
I love it, but I think it's just on days that we're so busy. Looking after 18 people is insane.
Blocked days are the worst. Like, sometimes bed block days is basically when there's literally every bed is full, and obviously you get people that have obviously delivered and that need to also come over. So then when the postnatal ward is bed blocked, labour ward gets bed blocked, birth center gets bed blocked, because we're just trying to, do you know what I mean? And then when that happens, once someone goes, someone straight in. Like,
you're literally trading sometimes, in and out. It's like
you don't get time to breathe, because as soon as you discharge someone, a new person's coming, and it's like, oh my gosh, like,
when will it be over?
It is and then on top of that, again, you still have like all your patients to look after.
So I think this part of it is to say, please have grace and patience with us. We are human. We are trying, and all of us are doing this because we love what we do. Yeah. But it can be overwhelming for us as well. And just bear with. Like, we will get to you at some point. Remind us gently. Yeah. But just before you get angry and start shouting at us, just keep in mind that, yes, you're important. Yes, you need your stuff done. But I also have 8 other babies and mothers to tend to, and sometimes they might be sicker babies and sicker mum. Not to say that
you're not sick enough, or you're not important. But again, we have to put things in order of priority in this job a lot of the time.
Yeah. Yeah, so I think we have said our side of it. Hopefully, y'all don't get mad at us.
Please. Please, I'm just a midwife, okay? Don't arrest me. I'm just a midwife, okay? I'm just speaking on. And obviously, like, I know that some people do have terrible experiences on the postnatal ward and like do get midwives that maybe haven't cared for them that they expected to. And sometimes it is just that. Sometimes it is just that, and I apologize again. And do you know how many people I've apologized for on this podcast? The amount of people we've apologized for. Anyway, yeah. Obviously, sometimes you do just get the odd midwife that's not as considerate and caring.
Yeah,
but the majority of us really do try our best.
Our best, honestly. Give the best care
possible.
So just bear with, please and thanks.
But like you were saying, it's so hard to like pick apart of like postnatal just because like so much goes on.
I think so. We've done kind of like on a midwife's perspective. I think we maybe touch on going home. So we kind of touched a little bit on discharging as well, like the talk and the meds you need and stuff like that. So when you get home postnatal, I think that's when your real postnatal period begins, really and truly.
Because you have that coverage and that protection of us
in the hospital. It's like a blanket over your head almost.
And then
like,
once you go home,
even though you're feeding baby, sometimes we're feeding baby for you. We're sterilizing the bottles for you. We're doing all these things. When you get home is really when the real journey begins, when you're on your own. And I think a lot of women tend to find it very daunting and overwhelming. And it is. I can only imagine that it is. But yeah, we can dissect that aspects of it.
Again, probably every trust probably works maybe differently. I don't know. But with us, so a midwife should come and see you. Again, depends what time you go home as well. I think it's if you go home before 12, they'll come and see you the next day.
After,
so if you go home before 12, they should usually come and see you the next day. If not, then the
early afternoon. Because when does someone go home before 12?
Yeah, do you know what? Yeah. It probably is early afternoon.
I think again, it depends. Working times.
Yeah, within their working times. If they obviously get notification that you've obviously left the hospital in time, then they'll obviously organise a visit for the next day. And if they don't come the next day, they should come the day after that.
And sorry to interrupt, just to say, if they don't come the next day, someone should always reach out to you, whether it's a phone call or a text, just to say, hi, we know you've been discharged, I'm your midwife, and then to arrange a date to come and see you, really.
And obviously we usually say, like, if no one contacts you by the second day you've been home, then there's always a number that's given to call. So we're always given that information just in case. And then the midwife comes and sees you at home. So I'm not a community midwife, neither are you. So I'm only talking based on what I did as a student, essentially, and obviously the information that we obviously do have. Obviously going home, okay. Before we actually get into the nits and grits of going home, we know a midwife comes and sees you at home. Before you're left, obviously you're given necessary emergency contact to contact, whether that's triage, A&E, your GP, 111, anything like that. One thing I will say, when you go home and you have an issue or you're worried about something, whether it's for yourself or your baby, a lot of women have it in their minds. They're like, oh, I'll just wait for the midwife. She's coming tomorrow anyways. No,
baby.
If you have a problem, if you have an issue, if you're worried about anything, you're worried about your baby, you're worried about your bleeding, anything, you come straight back. No one, is gonna be confused. No one's gonna beat you. No one's gonna be angry that you've come back. Okay, you need to come back. Don't wait for that midwife, because like I said, sometimes they won't even come by the second day. Very rarely, but this is the NHS. Let's be real, things get missed.
Things happen as
well.
Things
happen. Records get misplaced.
Short staffing.
So, you might not be seen till the 3rd, 4th day sometimes. So, listen, when we say come back, whether that's an hour of you being home, you come back.
Just
honestly,
to put that out there. I don't think you guys should overlook anything because you're told someone's supposed to be coming. It's kind of the same with being antenatal. If you're worried, just come in. Just come in.
Don't wait.
You are
welcome.
Wait.
Yes.
24/7.
24-hour service.
Yeah.
But yeah, so you go home. And then first, I think midwife weighs baby. Did they weigh baby on first day?
And it's day 3 and day 5 will weigh baby. So yeah, when you go home, I think usually if they come and see you the day after you've gone home, baby might be like a day 2 or day 1. It's just kind of like a check-in visit.
Yeah.
So it's just to see you, how you're doing, how's your bleeding, how you finding settling at home. Normally that visit is a bit of a quick one, answer all the questions you need, breastfeeding support and stuff like that. Day 3, someone always, and I mean always, has to see you on day 3 and day 5 of your child being born. So also to clarify, the day your child is born is day 0, not day 1, because sometimes people think it's day 1
no.
and then they get it mixed up. No, it's day 0, the day your baby is born. If your baby was born at 11:58, 2 minutes later it's now day 1. So it's very important to keep that in mind. So yeah, day 3 is just weighing you, weighing baby,
and jaundice check.
Jordan's check on baby, weighing baby, again checking in with feeding, nappies and how many dirties, how many wets, feeding.
If you had a cesarean, checking on your wound.
Yeah, signs of infections to that, you're bleeding, again how you're coping. It's hard settling in with a whole new human once you've gone home. So most of these are kind of like a welfare checks as well, because at least then you know for maybe 30 minutes of that day you've got someone
that's coming and checking on you.
Yeah, and then no one sees you on day 4, but I think I can only speak for the trust workout, but you always have a contact number. Yeah. It's not to say that they're going to reply to you as soon as you message them as well. Also, guys, don't use those numbers as a emergency
sorry,
helpline.
You actually just remind me. I remember on TikTok the other day, I saw basically...
Again? Another offense.
I saw basically someone on TikTok had an emergency. No, she didn't have an emergency. She basically was explaining that she wasn't happy with the care that she was receiving. Right. And she basically said that, I was texting my midwife. It's while she was pregnant, by the way. I was texting my midwife and my midwife didn't respond to me until the next day, or it was like 2 days. Guys, community midwives, I'm not a community midwife, but I know how it works, yeah? Yes, they work 9 to 5. After 5 o'clock, those phones are shut. That's their working hours, 9 to 5. Even you guys that work in corporate, if someone was to call you for a meeting at 5:30 when you finish work at 5, are you gonna answer the calls at the team's meeting? No, you're not. It's the same with midwives. That's why we give you triage. This is why we give you triage,
and
guys.
Loads of people have their maternity day units. Like, utilize the 24 hours.
That's what you need to be using. Even 9 to 5, even in those hours. Remember, the midwives are working. They're taking appointments. They're going to visits. So again, that is not the place to contact a midwife during an emergency, postnatally, antenatally. That's not the place. You need to use your triage. Yeah. You need to use it. No one else, like, if your midwife sees your message the next day, like, how she can help you? Guys, come on.
Let's be on the ball.
Let's be on the ball. Let's be on the ball. You need to call triage, because like we said, again, you're delaying your treatment, you're delaying your care, you're delaying, the help that we can give you by contacting the wrong people. Yes, your midwife is your midwife. If you're asking, I don't know, if you're texting to say you're going to be late for your antenatal appointment, or you're calling to be reminded of the time of such or something like that, fair enough. But guys, if there's actually something wrong,
like or there's an emergency, or you've got a bleed, they're not the people to be contacting. You need to
they're not. And they see so many different women, that your numbers aren't saved. They're not just gonna know who you are by you sending a text message. Like, they're gonna look and be like, who there? You know what I mean? So just wanted to
put that out there so you guys know. It's a very important point as well. What was I saying? Day 5.
Day 5.
So day 5 is a big day
when
babies are born. Yeah. So day 5, always someone has to come and see you at day 5. Day 5, the weigh baby again. So by day, so babies expected to lose weight during the first few days of being born. It's just expected.
Yeah.
But by day 5, we want them to kind of start putting on that weight back on. Babies will lose a little bit of weight, but we never want anything above 10% of a weight loss. So we weigh baby again to see at that point as well, the umbilical cord sometimes have fallen off. So looking at that signs of infection, checking for jaundice. And then the biggest thing that gets done on that day is the newborn blood spot, where you might get used. Some of you might know it as the heel prick,
heel prick test,
where they just do a little prick on baby's fur and then they take like 5 dots of blood.
Yeah. And it just checks for metabolic diseases. And it's sent off to Great Ormond Street Hospital, which is a specialist children's hospital. And then they basically tested to see if there's any genetic or metabolic diseases that can be picked up.
Yeah.
This is often all not mandatory, by the way.
Yeah, you don't have to do it. It's all like recommended practice.
Yeah.
No news is usually good news. I think it takes a couple of weeks for the letter to come.
It's quite fast if they pick something up.
I was going to say, if something's
posted
picked up,
usually straight away, but if it's picked up, you'll know quite quickly.
You will know. So if it's been a week and you haven't said anything, no news is good news. Then you get your letter through the mail a couple of weeks after. But essentially, those are the times where the midwives come to your home, from what I remember.
And if you're in hospital, they'll do it in the hospital.
We'll do it in the hospital, and then normally after day 5, from what I remember, again, things can change, but where I was doing community, they would do clinics, postnatal clinics.
Yeah.
So after day 5, you would come into a clinic with your baby to see baby, check in. And then usually you'd be discharged by day 10. I don't think it typically goes... It does, it could be up to 14.
So, you won't be discharged until your baby's back up to birth weight. So if that's longer than day 10, obviously you will stay under the care of the midwife. So it's just until... And obviously if you're concerned and you're worried about anything, obviously then the care sort of continues. I was gonna say, like, obviously you do have like the day after day 3, day 5, but in between that time, if you needed a midwife to come and see you, then you can request for a midwife to come and see you. Obviously if it's not a like emergency, whereas they'd be sending you into triage, of course. If it was just like maybe a bit of feeding support, they can then like come and arrange that for you. And I think in that time you see the health visitor as well. I don't know too much about what the health visitor does. I know they look after the baby up until the age of 6.
Yeah,
I think it's 6.
I thought 5, but 6, 5, same thing. What's it called? They normally get in contact with you from about day 10 that way. So it's normally,
usually they're fast. I've seen some ladies get the text message while they're still in hospital. Some of them are quite quick.
They don't arrange the meeting till around that time. So it's kind of like once you're being discharged from the midwife, then you now have the health visitor for baby. You have your GP for yourself. I think they're just there for like vaccinations and
development
and all of that stuff. Again, we don't know too much about what they do. We don't know. But they do good work.
They do the Lord's work. So I don't know too much about that.
Your health visitor will know, ask them.
But just to obviously touch on a little bit of postpartum, I feel like we do get a lot of women who go home and do have like concerns and issues, and then feel like they're like not listened to. Again, I think we've also all said this in previous videos a lot, and I want to speak to my black queens. Okay, everyone's a queen but black queens. Okay, I want to speak to my black ladies when I say the same way that we're prone to things antenatally is the same way we are prone to certain things postnatally. Bleeding. Black people are actually more likely to get fibroids. Fibroids can impact your bleeding. Before birth, during birth, after birth. If you are worried about your bleeding, you need to come back. You need to come back. Even if you're like on the fence, you need to come back, because bleeding is a massive thing postnatally. You might think that the bleeding's done after you give birth, but no, you bleed for a further 6 weeks or so. And you shouldn't be like filling a pad every hour.
It shouldn't be.
It shouldn't be soaking. It should not be soaking. We sort of describe it more like a heavy period.
Yeah.
It shouldn't be soaking.
Like the day 2 of your period.
Yeah.
Yeah.
And you could bleed for a different amount of reasons. Sometimes, this is going to sound so bad, but sometimes you might have not been stitched correctly. They might have missed a tear. It can happen, guys. I have to put it out there. Sometimes they can miss a tear, which might need to be sutured. So that is causing bleeding. Essentially, when your uterus is contracting, it's also expelling any products, tissues, clots, or anything that's within. So your uterus will not get back to its normal size and contract properly until everything is out and expelled. Sometimes it can be retained products, most of the time placenta, because that's sort of like the last bit of tissue to come out. And your uterus will not go down back to a normal size until all of that is out. And if you still have retained products, you will not stop bleeding. You can always come back in and have a scan for them to check for retained products as well and things like that. So please be looking out for that. Be mindful about that. Look out for your blood clots. Guys, let me know. You see me, everyone's different. Me, show me a picture. I love a picture. How gruesome it is. Even when it comes to your waters breaking or you're worried about any bleeding antenatally, posting, snap the picture and come and show me.
One thing we're finna do is take pictures of everything.
Take pictures and show me. It's actually the best way for us to even assess. Because sometimes when they describe things, sometimes you actually might think that sounds a bit normal. Yeah, that sounds a bit normal. But sometimes when you have a picture in front of you, and you can actually visualize it, and you're like, oh, that's not good. Do you know what I mean?
Yeah. And we always say your blood clot should not be bigger than a 50p coin. Yeah. So if you want, do side by side comparison. If it's looking and it shouldn't, like just no.
And I usually like to say like you should be able to, again, this sounds nasty, but you should be able to pull it apart.
Yeah.
You shouldn't.
Yeah. Yeah.
It sounds nasty, but you should be able to pull your clots apart to sort of assess.
Because essentially it's blood that's just clotted. So you should be able to
if it's actual tissue and it's rigid and it's not coming apart, yeah, baby. You need to come in. So
run it back.
And we have our ladies, like we said in previous, we have ladies that are black ladies who are more prone to hypertension and preeclampsia. You guys think preeclampsia always ends after you give birth? Most of the time, yes, because they do say the only way to cure preeclampsia is to give birth. However,
you can still your blood pressure
your organs can still fail you after delivery, even if you've had preeclampsia antenatally. So your blood pressure can still be on the rise. You can still have a lot of protein in your urine. You can still have serious swelling and seizures that you're still prone to that. So if you see your blood pressure is rising, a lot of the time when you do have hypertension, they should give you a blood pressure machine. Yeah. And if they don't give you one, get one. This is what we spoke about in terms of like, don't constantly always rely on the health care professionals, even though yes, it is our job, but there needs to be something in you that takes control over your own health too. Yeah, they don't give you a high blood pressure machine. Ask them for one or get one.
Guys, it's like £6 on Amazon.
Literally. Or you can get one to the pharmacy as well. Yeah. You can actually get your blood pressure checked to the pharmacy for free as well. So, do what's necessary, but these things can still continue postnatally. So you need to be coming in and putting your foot down. They tell you your bleeding's normal. You say, I want a scan then. Give me a scan. A lot of the times with bleeding anyway, we are very
on it. I think, I think we don't play about. I mean, we don't play about anything, but I think we all know how severe bleeding can be and the extent it can get to. So we really do try get move like a handle on it
as
soon
well.
as we notice something.
Yeah.
So it usually doesn't get there, but if it is getting there, definitely do something about it.
Yeah. And one of the massive things in maternity, sepsis.
In healthcare in general.
Yeah, in healthcare in
sepsis
general.
Is such the big thing.
It's such a big thing. It's
actually the number one leading cause of death in the world.
We obviously like you said, it's sort of global in healthcare, but in maternity, we do so many procedures, like from vaginal examinations to cesareans to breaking your waters, back balloons, vaginal
purposes.
There's so many like invasive that obviously, as we know, sepsis is basically an infection of the bloodstream.
Mm-hmm.
So all these things can cause infection to your blood. All of these things. Which is why when you do have a temperature in labor, we do not play.
We're very quick.
We are very quick to treat you and give you those prophylactic antibiotics as soon as, because we don't want that developing any further.
We don't want it to escalate. No.
So guys, when you get home postnatally, you are still prone to getting sepsis. You start feeling flu-like symptoms. Don't just think, oh, I have a cold. It's just a normal cold. Oh, I have a flu. No. You need to get back in hospital. You need to be checked out. Temperature, flu-like symptoms, just feeling generally unwell. We all know what it's like to just feel generally unwell. Mm-hmm. And I feel like sometimes we do brush off flu. Even normal, not being pregnant as well. Like a lot of the time we do get a bit of a flu and we're like, oh, whatever. But a little flu can be a big thing.
It can be a big thing.
It can be. We see people with amputated hands, bless them, and legs, feet, because of sepsis, and we'd hate for that, to get that far. So we always say, please be looking out for that as well.
Yeah. What else? So we've done like the visits that at home. Then you've got your healthcare visitors, and then you got your GP. So as the mother, you are usually in care of your trust till about up to 6 weeks. So after 6 weeks, then your GP takes over. So that's kind of another thing to sort out. But I think another thing I wanted to touch on is settling at home with a newborn. I don't think anyone knows what to expect until they're with there. But I think a little bit I would say is to be patient with yourself. I think, you leave that house as a just a person, and you come back as a mother, and you have this human to consider. And I think also babies cry.
Yes.
Babies cry, they scream at you. And sometimes you will find that your child is just crying constantly. You have fed the child, you have changed the nappy, you've done everything, and you're getting frustrated or upset now because the child is just crying. And sometimes it just happens. Sometimes they just cry. That's just, they just cry. And I think it's very important to remember that if you fed the baby, this baby's full. You've changed the nappy. You've ticked everything that you could think of that's bothering baby, and baby's still upset. Rather than getting yourself worked up and stressed, just take a minute, pass the baby.
Step back.
If you've got someone at home, a parent, a sibling, a partner, just give them to the baby and take a step back. Go stand in your garden for 5 minutes, make a cup of tea or something. I think it's very important to remember to put yourself first as well. You try to give it your all to prioritize this baby.
And we do understand that some people don't necessarily always have that support, and if that means sometimes just putting the baby down and just stepping away, because we do know that there is a raising percentage of babies have shaken baby syndrome, and we're really trying to cut those percentages down. So even on discharge talks, we are advising women to just remember not to shake the baby. We know motherhood can be like, I've never experienced it, but just by the field that I work in and having family members that have had children, it does get hard, but shaking the baby will not solve the issue.
And it's not to say anyone does it on purpose, because I think when it does happen, I don't think people notice it, but they're so tiny and it doesn't take much for them to be shaken.
Yeah.
So it's really
and even
important.
for them to bleed.
Yeah. exactly, internal bleeding. And also, a baby can't tell if Claudia's unwell. Claudia can tell me I don't feel well. If a baby's unwell, a baby can't open their mouth and physically tell me I'm not feeling well. So it's sometimes hard to pick up these things with babies. So it's important to try and prevent being in situations of any ifs. Do you know what I mean? But yeah, just taking out a time for yourself, giving yourself grace in the postnatal period. I think it will be challenging. It might be hard, especially if you don't have as much support around you as you may wish to have. Feed yourself. Try and get sleep because you need to be well to look after a baby well.
And we do understand that there's going to be times where, you know,
of course,
that's not going to be possible. And we do have, you know, mental health factors that may contribute. We know that postpartum depression, which we will talk on, it is a massive contributing factor to how a baby is cared for and how a mother carries out her postnatal period. But there is always someone to speak to. We have specialist perinatal healthcare midwives that are specialized in these things. And I've heard so many like good and successful stories from that. You know, I've had a lady who told me she was even hallucinating, like she wanted to jump off the train, like she said that she wanted to jump off the train, and postpartum she basically was convinced she had a brain tumor. So she kept going to the GP, everything, to the point where she thought that no one was listening to her and she was gonna die. So she said she literally just wanted to jump in front of a train. But she said it was actually her partner who helped her get in touch with the perinatal health team, and they helped her, and she said like they're the best, and she had them all the way through to, so when I was looking after her, this was a different pregnancy, so she went through that in her last pregnancy, and that team followed her through and then reconnected with her in the next pregnancy.
That's really nice.
And helped her throughout that, and she was she found them so helpful. So yeah, like these services, like they're there for you guys to use, they're there for you guys to have, and sometimes mental health is, you can't predict it. It's not always preventable. Lack of support, lack of resources can also contribute to these factors, but there's people out there to help.
And it's important, you know, that there's these sources out there, and just to access them, and don't feel shy or embarrassed.
Like, you've had a whole baby, like that is a massive
no one can say anything about that. I think if you need the support, it's important to recognize that and to access that. But also for the partners out there that are watching, it's also important that you can recognize within your partner and be like, actually, you are not the same. You have changed. I can see this and that. Because sometimes they may not see it, but if you can see it, you can spot it. And often you will see it before they do. Bring it up to them and just try and get a handle on it before you reach the point where you feel like you want to, you know, jump off and but I think this is a little overview
and taster
of what you can expect after birth. I think we've touched on various aspects of it, and aspects of a midwife, and then of a patient. Like Claudia said, we'll do an episode on like the mental health side of this. But for now, for today, that is all we've got
for you guys. Thank you again for tuning in. And
like, please, share, subscribe.
Follow us on all our social medias, okay? And we will see you on the next episode. Bye.